Welcome back to the deep dive. TB, tuberculosis, always seemed like, well, a disease of the past to me. But
Hmm.
the research you sent over paints a very different picture.
Yeah.
It's pretty extensive, too. We've got medical journals and transmission studies, even some stuff focusing on animal health.
Yeah, it's a lot to unpack.
Definitely. So today we're doing a deep dive into why TB is still a major global threat in, well, 2024.
It really is fascinating. We often think of diseases, particularly bacterial ones, as solved once we have antibiotics. But TB, well, TB shows just how complex these battles can be, even centuries after we first identified it.
Right. So let's start with some basics. TB, it's a bacterial infection,
Right,
right?
caused by Mycobacterium tuberculosis.
Okay.
And one of the things that really jumped out at me from the research, I mean, it's widespread, but a quarter of the world's population is infected with TB bacteria,
A quarter. Wow. Okay, that's
according to the World Health Organization.
wow, that's a lot higher than I thought. How does it spread? I mean, how do people catch it?
Primarily through the air.
Oh, so like a cold or flu.
It is similar, but when a person with active TB, not latent, coughs or sneezes or even talks, they expel these tiny droplets, and those droplets contain the bacteria.
Okay.
And what's really interesting, I think, is that these droplets, they can remain airborne for hours, which makes TB much more contagious than a common cold, where the droplets fall to the ground pretty quickly.
Yeah, I can see why that would make it so much harder to control.
Right.
And the research mentioned something about foodborne transmission.
Oh, yeah.
I thought that was interesting.
Yeah, it is. It's less common, for sure.
Okay.
But consuming unpasteurized dairy products, for example, from infected animals, can be a source of infection.
Mm.
So that's something else to think about.
So it's not just person to person. It's
Right.
we've got to consider the food chain as well.
Exactly. And this is where things get even more, I guess, well, more complex.
Yeah.
Because not everyone who's infected with the TB bacteria actually gets sick.
Oh, right, right. There's a difference between latent TB infection and the active TB disease.
Exactly.
And the research touched on that. Could you explain that for our listener?
Sure, yeah. So in latent TB infection, the bacteria are present in the body, but the immune system is keeping them in check.
Okay.
So the person doesn't have any symptoms and they're not contagious.
It's like a ticking time bomb almost, right?
Yeah, that's a good way to put it. Because latent TB can reactivate
Oh, wow.
and become active TB disease if the person's immune system weakens. And that happens in about 10% of the cases.
Yeah.
So then with the active TB, the bacteria are multiplying rapidly in the body, and that causes symptoms like, well, everybody knows, a persistent cough, fever, weight loss, and fatigue.
So that's when it becomes, a serious health risk, not just for the individual, but for those around them too.
Yeah, exactly. Active TB is contagious, and if
Wow.
it's left untreated, it can be fatal.
Wow. Okay, and the research, it really emphasized the severity of TB as a global health issue, especially in low and middle income countries. Why is that? Why is it so much worse in those areas?
Well, it's multifactorial,
Mm.
for sure. But one of the things that stood out in the research to me, and maybe it's something that our listeners haven't thought a lot about, is the link between socioeconomic conditions and TB incidents.
Okay, that makes sense.
There was a study in The Lancet, and they found that poverty, overcrowded living conditions, malnutrition,
Yeah.
these significantly increase the risk of both infection and disease progression.
Yeah.
And that's, well, that makes sense, but it's striking to see it right there in the data.
Right. So it's not just about the bacteria itself, it's the environment in which people are living that,
And,
that impacts their risk.
and then you layer on top of that limited access to healthcare in many parts of the world,
Yeah.
and it becomes even more challenging to control the spread of TB.
Yeah, I see what you mean. It's like this perfect storm almost
Right.
of all these different things. It's biological, it's social, it's economic.
It is.
And then on top of that, we have this issue of drug resistance, which just complicates the problem even more.
Yeah, and this is what I find fascinating, honestly, is it's not just about bacteria evolving randomly. It's our actions
Yeah.
that can actually drive the development of drug-resistant TB.
What do you mean?
Well, one of the key drivers of this is incomplete or improper treatment.
Oh, interesting.
So if someone doesn't take their TB medications as prescribed, it gives the bacteria a chance to survive and develop resistance to those drugs.
Oh, so we're almost selecting for the toughest bacteria.
Yeah, it's kind of like, it's like a form of artificial selection.
Wow.
And it's leading to these multi-drug resistant TB or MDR-TB.
Right, and that's much harder to treat, obviously.
And MDR-TB, it accounts for nearly 500,000 cases worldwide each year. It's associated with much higher mortality rates.
That's a lot. That's scary, honestly.
It is alarming.
And the research also talked about XDR-TB.
Right.
Extensively drug-resistant TB. What's the difference between that and MDR-TB?
So XDR-TB is basically MDR-TB that's developed resistance to even more powerful drugs.
Oh, wow.
So it leaves very, very few treatment options. It's kind of a nightmare scenario.
Yeah, sounds like it.
Right. It's like this constant arms race, right?
Yeah.
We're fighting against these evolving bacteria,
Yeah.
trying to stay one step ahead.
Right. And that leads us to, well, another big part of this, and I'm sure our listeners are familiar with this, but this link between TB and HIV/AIDS.
Right.
It seems like having one of these diseases makes you more susceptible to the other, right?
That's exactly right. Individuals with HIV, they have weakened immune systems.
Well.
Right. So that makes them much more vulnerable to developing active TB.
Okay.
And in fact, TB is one of the leading causes of death among people living with HIV.
Oh, wow.
So it's a very serious problem.
So it's like a double whammy, basically. But I'm curious, how does HIV increase the risk of TB?
Well, it's all about immune suppression, right?
Yeah.
So HIV attacks these cells, these T cells, that are crucial for fighting off infection, including TB bacteria. So this means that even a latent TB infection can easily reactivate in someone with HIV.
Oh, wow.
So it's a big problem.
So it's not just about, kind of the bad luck of getting two terrible diseases.
Yeah.
It's that one makes you much more susceptible to the other.
Exactly.
Okay. And the research talked about how this connection really changes how we manage both diseases.
Yeah,
Right.
it does. And I think one of the key takeaways here is that we really need integrated approaches to treatment.
Okay.
Treating HIV and TB separately as separate entities.
Right.
It's not enough. We really need to screen for both infections simultaneously.
Yeah.
And we need to provide comprehensive care that addresses the needs of individuals with both conditions. It's not easy.
So it's not just about the medical treatment. It's about a holistic approach that understands that these two things are connected.
Exactly. And there's another layer to this interconnectedness that's pretty fascinating.
Yeah.
And that's the link between human and animal health.
Right. Zoonotic TB.
Yeah.
I'll be honest, I was really surprised to learn that TB can be transmitted between animals and humans.
Yeah, it's not as well known as some of the other zoonotic diseases, but it is a significant concern.
Okay.
The main culprit here is Mycobacterium bovis, which primarily affects cattle, but can also infect humans.
And I think the research mentioned something about a case in a rhinoceros, right?
Yes, there's this rhino in a Polish zoo, and they found that he had an INH-resistant strain of Mycobacterium tuberculosis.
A rhino with drug-resistant TB.
It really highlights the complex web that we're dealing with here.
That's a little scary.
It is. And INH, it stands for isoniazid. It's one of the key drugs that's used to treat TB in humans. So the fact that this strain was found in a rhinoceros raises some serious concerns about spillover, transmission from wildlife to humans, and also the potential for spreading this drug resistance.
Yeah, that's concerning.
It's definitely something to think about. And this is why the One Health approach is really being emphasized more and more.
Right. Because we can't just focus on human health in isolation.
Exactly.
It's all interconnected.
Animal health, environmental health, human health, it's all one big system.
Right. So how does this One Health approach actually work, when we're talking about something like TB?
Well, it's all about collaboration.
Okay.
So you have veterinarians working with public health officials, researchers working with policymakers.
Yeah.
And it can be as simple as things like routine testing of cattle for Mycobacterium bovis. And that can help prevent the spread to humans through, things like the consumption of unpasteurized milk.
So by protecting animal health, we're also protecting human health.
It's a win-win situation.
It is a win-win.
And it's not just about livestock. We need to consider wildlife populations as well. That rhino case it's a reminder that these connections exist, even if we don't always see them.
Okay, so we've covered a lot of ground here. We started with the basics of TB, how it's transmitted, talked about drug resistance, the connection with HIV/AIDS, this One Health approach.
Yeah.
But there's one piece of this puzzle I really want to dig into a little bit more, and that's...
You're thinking about the social and economic factors that drive the TB epidemic.
I am. We touched on them a bit, but I think it deserves a deeper dive.
Okay.
The research really showed how poverty, living conditions, access to healthcare, all these things play a huge role in how TB spreads.
Yeah, it's not just about the biology.
Right.
It's about the fabric of society
Yeah.
and how that can really influence disease transmission.
And those social determinants of health, I feel like they're so often overlooked.
Yeah, I think you're right. And that's a problem because we can't really effectively address TB without considering the social and economic context in which it thrives.
Okay, so let's dive into that a little bit more.
Mm.
Reading through all this research, it really struck me how poverty creates this, like, I don't know, this perfect storm for TB to really take hold.
Yeah.
It's not, I mean, it is a disease, but it's almost like a symptom of deeper inequalities. You know what I mean?
Yeah, that's a really good way to put it. Poverty, it often goes hand in hand with overcrowded housing,
Right.
inadequate nutrition, limited access to health care.
Mm.
All of these factors make individuals much more susceptible to both infection and disease progression.
It's like a vicious cycle, right?
Yeah.
Poverty increases the risk of TB, and then TB makes it harder to work, harder to support your family, so it just kind of keeps going, keeps spiraling.
It can be very difficult to break free from that cycle once it gets going.
Yeah, and it's not just material resources either, right? I mean, there's the stigma
Oh, yeah.
around having TB,
Huge.
which can really prevent people from getting the care they need.
Absolutely.
Imagine you're struggling to make ends meet, and then you get diagnosed with TB, this disease that has so much, I don't know,
Shame.
shame.
Stigma, yeah.
Would you risk telling your employer,
Right.
risking losing your job? I mean,
It's a tough decision.
it is. And
No.
would you tell your family? I mean, if you're worried about being ostracized,
It's a lot to carry.
it is. And it just allows the disease to spread further, right? Because
Absolutely. The World Health Organization, they really emphasize that successful TB control programs,
Yeah.
they have to address these social determinants of health.
Yeah.
We can't just focus on the medical side of things.
Right. So what would those interventions look like? I mean, what can we do?
Well, one example is improving housing conditions,
Yeah.
adequate ventilation, and reduced overcrowding. I mean, these things
That makes sense.
can significantly reduce the risk of transmission.
Yeah. 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 I mean, if the bacteria can't spread as easily, fewer people are going to get infected in the first place.
Exactly. And then there's the issue of food security.
Okay. Right.
I mean, malnutrition weakens the immune system,
Right.
making people much more susceptible to TB.
Yeah.
So programs that ensure access to nutritious food, I mean, that's essential.
Yeah. It's about creating a world where people aren't just surviving.
Right.
They're actually thriving.
It's about giving them the tools they need to be healthy.
Exactly. And we can't forget about education,
Yeah.
awareness campaigns.
Absolutely. We need to break down the stigma
Yeah.
surrounding TB and really empower people to seek care without feeling judged.
Yeah. I mean, knowledge is power, right?
Exactly.
The more people understand about TB, how it spreads, how it can be treated, I mean, the better they'll be able to protect themselves,
Yeah.
protect their families and their communities.
I think education is one of the most powerful tools that we have.
Yeah, absolutely. The research also highlighted this other layer of complexity, and this was kind of a surprise to me, the impact of climate change on the TB epidemic.
Oh, yeah.
I mean, how does climate change, how does that fit into this picture?
Well, climate change, it affects pretty much every aspect of our lives, right? From weather patterns,
Right.
migration patterns, and all of these things can have an impact on infectious diseases like TB.
Can you give us an example?
Sure. Think about extreme weather events like, floods and droughts.
Okay.
These disasters, they can displace entire communities.
Right.
People are forced into these crowded, temporary shelters where the risk of TB transmission is much higher.
Right. And those same disasters can really disrupt healthcare systems,
Yeah.
making it even harder to access the care that people need.
It creates this really challenging situation.
Yeah.
And then you've got migration patterns changing.
Right.
Climate change is a driver of migration as people have to leave their homes because of rising sea levels, desertification,
Right.
other climate-related factors.
And if they have TB, they could be bringing it to new areas.
Exactly.
And it makes it harder to treat them too, right? I mean, if they're moving around,
It really does.
you don't have that continuity of care.
It's a huge challenge.
So it really feels like climate change is just adding fuel to the fire.
Yeah, it definitely complicates things.
Yeah.
And it underscores the need for this global, coordinated response.
Right.
We can't just address TB in isolation.
Right.
We have to consider these broader environmental and social factors.
So it's not just about, new drugs or vaccines.
Right.
It's about addressing these underlying
Systemic issues.
systemic issues.
Absolutely.
Okay. We've talked about poverty, stigma, climate change.
Why?
It can be a little overwhelming.
Yeah.
But amidst all of this, I mean, there's got to be some reason for hope, right?
There's a lot of hope. The research highlighted some really promising developments
Okay.
in TB management. For example, the use of digital technologies.
Oh, interesting.
I mean, that's revolutionizing how we're approaching diagnosis, treatment,
Okay.
patient support.
Tell me more about that. How is technology being used to combat TB?
Well, one area is mobile health apps.
Oh,
These apps can help patients track their medication,
okay.
receive reminders to take their pills,
Yeah,
even connect with healthcare providers remotely.
that's great. Especially for those areas where it's hard to get to a clinic.
Exactly.
Yeah.
Exactly. And it's not just apps,
Yeah. Yeah.
We're seeing the use of artificial intelligence in TB diagnosis,
Wow.
which can help identify cases earlier and more accurately.
Okay.
And you've got telemedicine,
All right.
which allows patients to consult with specialists remotely.
So we're overcoming these geographical barriers,
Exactly.
but also some of those stigma barriers as
Yep.
well.
Exactly. Yeah, it's pretty remarkable.
It is. And it's amazing how technology is making healthcare more accessible
It is.
to people all over the world.
And these technological advancements, they're being coupled with new approaches to treatment as well.
Okay.
For example, there's a growing focus on personalized medicine.
Okay.
So tailoring treatments to individual patients based on their genetic makeup and other factors.
So moving away from that one size fits all
Exactly.
to something that's much more
Targeted, yeah.
and hopefully more effective.
Okay. And are there any new developments in, drug development?
Yeah, there's a lot of exciting work being done in that area.
Okay.
Researchers are working on new drugs that are more effective against drug-resistant strains.
Okay.
They're exploring new drug combinations to try to shorten treatment times
Okay.
and improve outcomes.
It's encouraging to know that there are so many people
Yeah,
working on this problem.
it's a global effort.
It is.
Yeah.
But it's not just about the science and the technology,
Right.
right? We also need political will.
Absolutely.
We need governments around the world to commit
Yeah.
to making this a priority. We need funding for research, funding for public health programs.
So it's this multi-pronged approach.
It is.
Science, technology, policy, community engagement.
It all has to work together.
All these pieces have to come together.
Yeah, and while the fight against TB is far from over,
Yeah.
I think there are a lot of reasons to be optimistic.
Yeah.
We're making progress, and with, continued effort and collaboration,
Yeah.
I believe we can conquer this ancient foe.
It's a powerful message of hope.
I hope so.
And as we wrap up our deep dive into this complex world of tuberculosis,
Yeah.
what would you say, what's the one thing that you really want our listeners to take away from this conversation?
Going through all of this, what really sticks out to me is that TB, it's not just a medical problem.
Right.
It's really a reflection of deeper, societal issues,
Yeah.
We talked about poverty, inequality, climate change.
Yeah.
All these factors create the conditions where TB can just thrive.
Like TB is this warning sign, that something is wrong with our, with our social and environmental ecosystems.
I think that's a great way to put it.
Yeah.
It's like a canary in a coal mine.
Yeah.
And that's why I really think the most important takeaway here is this need for a holistic
Yeah.
approach.
Yeah.
We can't just focus on treating the disease in isolation.
Right.
We need to address the root causes that allow it to flourish.
So we need to think beyond just the individual patient
Yeah,
and really consider the entire context of their lives.
absolutely. Think about it. Providing someone with TB medication, that's crucial.
Right. Of course.
But it's only one piece of the puzzle. I mean, what happens when that person goes back to an overcrowded home with poor ventilation?
Right.
Or if they can't afford, nutritious food to help them recover?
We're setting them up to fail almost.
In a way, yeah.
Yeah.
We need to create an environment where people have the resources and opportunities to be healthy.
Yeah.
And that takes a multi-sectoral approach, Healthcare providers, working with social workers, policymakers, collaborating with community organizations,
Yeah.
researchers, engaging with the people who are most affected by the disease.
We've got to break down those silos, those barriers.
Exactly.
And really understand that health is connected to so many other things in our lives.
It really is.
Yeah.
And it's about empowering people
Mm-hmm.
to take control of their own health.
Right.
So this means giving them access to education, raising awareness about TB, addressing the stigma
Yeah.
that keeps people from seeking care.
It's about creating this culture of health
Yeah.
where everyone feels supported and empowered to make good choices.
I think that's a great way to put it.
Yeah.
And while the fight against TB, it's complex, it's multifaceted,
It is.
I really believe this holistic, community-driven approach, this is what gives me hope.
Yeah, I agree.
This is what's going to create lasting change.
It is. It's about understanding that we're all interconnected in this.
Yeah.
And by working together, we can make a difference.
I agree.
Well, this has been a really, really insightful conversation.
Yeah.
A huge thank you to you for lending your expertise to this deep dive.
It's been my pleasure. I always enjoy these conversations.
Yeah.
It's so important to look at these complex issues
Yeah.
and really see how everything is connected.
It is.
Yeah.
And to our listeners, thank you so much for joining us on this journey. We hope you found it, well, informative, inspiring.
Yeah.
Remember, knowledge is power.
It is.
And the more we understand these challenges,
Yeah.
the better equipped we are to actually make a difference.
Absolutely.
So be sure to check out the show notes. We'll have links to all the research we talked about
Yeah.
and some resources if you want to get involved in the fight against TB.
Yeah. And remember, even small actions
Yeah.
can make a big difference.
Yeah.
Whether it's educating yourself about TB,
Yeah.
supporting organizations, just talking about it with your friends and family,
Yeah,
every little bit counts.
absolutely. Until next time, stay curious, stay engaged, and stay healthy.